Chronic kidney disease, CKD, or chronic renal failure, CRF, as it was historically termed, is a term that encompasses all degrees of decreased kidney function, from damaged at risk through mild, moderate, and severe chronic kidney failure. CKD is a worldwide public health problem. In the United States, there is a rising incidence and prevalence of kidney failure, with poor outcomes and high cost. CKD is more prevalent in the elderly population. Almost half of the patients with CKD are older than 70 years. However, while younger patients with CKD typically experience progressive loss of kidney function, 30% of patients over 65 years of age with CKD have stable disease. CKD is associated with an increased risk of cardiovascular disease and end-stage kidney disease, ESKD. Kidney disease is the 10th leading cause of death in the United States. The Kidney Disease Outcomes Quality Initiative, KDOQI, of the National Kidney Foundation, NKF, established a definition and classification of CKD in 2002. The KDOQI and the international guideline group Kidney Disease Improving Global Outcomes, KDIGO, subsequently updated these guidelines. These guidelines have allowed better communication among physicians and have facilitated intervention at the different stages of the disease. The guidelines define CKD as either kidney damage or a decreased glomerular filtration rate, GFR, of less than 60 ml min1, 73 square meters for at least 3 months. Whatever the underlying etiology, once the loss of nephrons and reduction of functional renal mass reaches a certain point, the remaining nephrons begin a process of irreversible sclerosis that leads to a progressive decline in the GFR. Staging the different stages of CKD form a continuum. The stages of CKD are classified as follows. Stage 1, kidney damage with normal or increased GFR, 90 ml min1, 73 m2. Stage 2, mild reduction in GFR, 60, 89 ml min1, 73 m2. Stage 3A, moderate reduction in GFR, 45, 59 ml min1, 73 m2. Stage 3B, moderate reduction in GFR, 30, 44 ml min1, 73 m2. Stage 4, severe reduction in GFR, 15, 29 ml min1, 73 m2. Stage 5, kidney failure, GFR, 15 ml min1, 73 m2 or dialysis. Signs of metabolic acidosis in stage 5 CKD include the following: protein energy malnutrition, loss of lean body mass muscle weakness, signs of alterations in the way the kidneys are handling salt and water. In stage 5 include the following: peripheral edema, pulmonary edema, hypertension. Anemia in CKD is associated with the following: fatigue, reduced exercise capacity, impaired cognitive and immune function, reduced quality of life, development of cardiovascular disease, new onset of heart failure or the development of more severe heart failure, increased cardiovascular mortality. Other manifestations of uremia in ESKD, many of which are more likely in patients who are being inadequately dialyzed, include the following: output,